Hey, good morning. I'm Paige Browning. It's Monday. This is Seattle Now. Changes to Medicaid from Congress's One Big Beautiful Bill Act are continuing to trickle down to people in Washington state. Local officials are working to notify certain non-citizens who will soon be ineligible for this health program and set them up with other supports. We'll hear more from Public Health Seattle King County's Daphne Pye in a minute, but first, let's get you caught up. A sunny, food-filled Sunday night in Seattle ended in tragedy. 3 people were fatally shot, and 4 more were injured in a shooting on the Seattle Center campus. We don't know their identities as of yet. As of last night, Harborview Medical Center is treating 3 victims, including a toddler, who are all in satisfactory condition. Seattle police say officers arrested 1 suspect last night and are questioning another person, and will get more information from authorities today, but know that 3 deaths are confirmed, and it happened in front of busy crowds at the Bite of Seattle Food Festival. Washington state could be on the hook for more than $1 million in damage repairs for vandalism at the state capitol. A man broke into the capitol last October, setting fires and tipping over busts of George Washington and Martin Luther King Jr. The most expensive repair is for a burnt historic rug, which could cost about $960,000. Lawmakers so far have approved spending $250,000 on repairs, but are waiting on the rest pending insurance payouts. And the annual Tribal Canoe Journey arrives in Suquamish today. The journey brings people together from the Pacific Northwest and Alaska to travel by canoe upon ancestral waters to share stories, gifts, and songs at each stop. The Suquamish tribe estimates it'll host 8,000 to 10,000 guests for meals and campsites before the canoes continue on to Muckleshoot on Wednesday. We'll be back with more headlines on tonight's episode of Seattle Now. And with that, here's host Patricia Murphy in conversation with Daphne Pye.
Changes from Congress's so-called One Big Beautiful Bill Act continue to impact people in Washington. The act is a massive tax and spending bill that affects everything from business taxes to clean energy rebates. It also impacts Medicaid. And here in Washington state, this will affect a lot of people. In 2025, Republican Representative Brett Guthrie of Kentucky spoke in support of the act in the U.S. House.
House Republicans are eliminating waste, fraud, and abuse to focus Medicaid on the most vulnerable.
Recently, local health officials say they sent letters to thousands of non-citizens in the state saying their Medicaid eligibility may be taken away. Starting October 1st, certain non-citizens who are in the country legally, like refugees and asylum seekers, won't be eligible for this health program. Local health officials are trying to figure out other ways to support people. Daphne Pye is a regional health services administrator with Public Health Seattle King County. She's here to help us understand how her team is working to find coverage for people ahead of this transition. Daphne, good to see you. Thanks for taking the time.
Oh, you're welcome. Thank you for having me.
So for listeners who may not know, briefly, what is Apple Health in Washington? How does it work?
Apple Health is really the umbrella name for all of our Medicaid programs in the state. And so if someone's on an Apple Health program, in most cases, they're getting medical, dental, vision, prescriptions, x-rays. Unless you're on a children's medical program, you have no copays. You have no co-insurance. You have no deductible. It's very comprehensive. It's a really great insurance program for our residents to have.
What's changing with Apple Health eligibility?
One of the first changes that we see is going to happen on September 30th. And because under, as you mentioned, Big Beautiful Bill H.R. 1, because the definition of who is a non-citizen, how a non-citizen can get Apple Health is changing. So now our refugees and asylees are now going to have a green card in order for them to get Apple Health, to get Medicaid. There will be some exceptions. For example, individuals who are from the Kofa Islanders, Marshallese, they will be exempt. Haitian and Cuban individuals will be exempt. But our non-citizens, refugees, asylees, and other categories like Afghanistans, they have special permission to be here. They will also need to have that green card to get Apple Health.
How are you thinking about these changes, Daphne? What are you concerned about here?
Yeah. My biggest concern are individuals who are in the middle of treatment or they have these severe health conditions. I fear that on October 1st, people are going to walk into the pharmacy to get their medication and they're going to say there's no coverage. They go in to get their behavioral health services and they say, I'm sorry, you have no coverage. that really hurts. And because I know we're going to be impacted. I know all the work we do, all the work our partners do, because our partners are just embedded in this. We're still going to miss clients. There's still going to be those clients that are going to walk in and they lost their coverage. And that's my biggest fear.
Is there anything people can do to avoid losing coverage?
Yeah, one of the things that we are doing now very intently is that, one, we have to identify these clients. So our organizations that are working with non-citizen refugees, we have to start identifying them. And that's not going to be easy because you don't know who's a non-citizen. We don't have a system that will say, okay, Patricia, you're a non-citizen. But we have to first identify them. Then what we have to do is the first question we want to ask these individuals is, have they changed their refugee, asylee, or non-citizen status to a green card? Do they have a green card? In most cases, a refugee and asylee, if they've moved to a green card, we can get them back on Apple Health if they meet income requirements. We can get them on another Apple Health program. For other individuals, they may have to meet that 5-year residency requirement. But if they do have that green card, it could be that we can move them to another Apple Health program. The second thing we want to do is we want to evaluate individuals for any type of emergent medical condition. Are they getting cancer treatment? Are they getting kidney dialysis? And if they are, there's another program that's an Apple Health Medicaid. We call it Alien Emergency Medical. They could be eligible for. Are they pregnant? Have they been pregnant in the last 12 months? Again, there's another program in Washington State they could be eligible for. If the individual doesn't meet any of those categories, the next thing we're going to ask them if they have a physical or mental condition that prevents them from working. Because if they do, what we have to do next is we want to do an application to Department of Social and Health Services and see if the client is going to be eligible for Housing and Essential Needs Program, or are they going to be eligible for DSHS Medicaid Care Service? Medicaid Care Service, if we can get a client approved on that, is going to provide state-funded Medicaid or Apple Health coverage. And kind of the last thing, Patricia, if none of our clients meet any of that, most of them, if not all of them, would be eligible to purchase a qualified health plan. And as you know, with qualified health plan, you're going to have monthly premiums, you're going to have co-pays, you're going to have co-insurance. But in our state, the Health Benefit Exchange has made some really great changes. And so we would be able to at least look at their situation and see if we can't get them on a qualified health plan and how much that premium would be.
You know, it sounds like there are options for people like you've described, but they have to find you.
That's
you have
right.
to find them to take advantage of it. How are you thinking about reaching out to people? And what kind of trust are you trying to build at this point?
That's a good question. One of the things that we have is a King County Navigator Network. So any organization in King County or any of those counties that want to enroll folks into health insurance, they have to come through public health. The King County Navigator Network, there's 38 agencies and over 380 navigators. So the first thing we're doing, we're really empowering them, giving them the tools that they need to help them reach out to the clients. We're in the process now of doing a huge marketing campaign. So we're actually going out in the community to businesses, to areas where our non-citizens may congregate. Where do they go to the store shopping? What businesses do they utilize? We're taking materials. We're putting materials out.
Do you have a sense of scale here? How many people might this affect?
Good question. We've been asking that same question. We were initially told statewide there was about 14,000 people. Now the number has reduced. Now they're saying it's only about 12,000 people that could be impacted. So that's on a state level. We keep asking how many that is on a county level. So we only can make assumptions because King County, of course, is the largest county. And so maybe within that, maybe we have 7,000 people. That's an estimate of who could be impacted. That's still 7,000 people too many, but that is the numbers. Those are some of the assumptions that we are going with. And as you mentioned earlier, the first letter went out to clients. It went out on July 13th. So folks are getting those letters. And within the letters, it's saying, if you change your immigration status, because some people do change their status and they just don't tell us. They've gotten a green card, or maybe they've even became a citizen and we just don't know. So if they updated their citizenship status, we need to know that. If they do have an emergent medical condition, we want to know that because that's really going to help us help our clients find other health insurance options.
A lot of these federal cuts were out of your hands.
Absolutely.
Changes to different health programs, eligibility happen all the time. Have you triaged something like this before?
Yeah, well, I've been with the health department now for 30 years. So I've been around when we had basic health plan. I've been around when we've cut the children's programs. I've been around for a long time. And I think that's one of the unique things about how we're leading the work, because my program managers on my team, they've done this work, some of them 20, 25 years. They've been around through change. So we've been through change. So we're able to stand things up a little quicker because we have the history of having to stand a program up, take a program down. And so we've been there. And it doesn't make it any easier, right? It doesn't. And with these phased approaches, because it's Medicaid now, but back in October, it started with DACA, Deferred Action for Childhood Arrival. They lost their premium assistance. Then in January, it was residents who are here legally on a green card, income is under 100% of the federal poverty level. They lost their premium tax credit. So this is just gradual, hit that we continue to take. Because as we get to January, we'll be to Apple Health work requirements, and then people on Medicare who are non-citizen losing Apple Health.
As you mentioned, these letters have already gone out to people. What have you heard? What is the response when you're hearing from people who are getting in touch?
Yeah, right now, we haven't heard a whole lot.
Yes.
Does that concern you?
It concerns me, but it's not unexpected because it's the letters, right? Clients will get letters from Healthcare Authority or DSHS, and they may not read them.
Why do you think that is?
I think people get so bombarded about letters, right? Or it's not in their language, or they really don't understand. People are transitory. So we may have one address, and then they move and they don't tell us, and then they don't get their mail. There's numerous reasons. A lot of it is fear to have to pick up the envelope and read it and say, I'm losing my coverage. What does that mean?
Yeah, the stakes are high.
Absolutely.
The stakes are high.
Yes.
And this is a difficult climate for non-citizens.
Absolutely. Right. So they're getting bombarded on several areas. I was on a meeting yesterday when they said, well, a lot of clients may not respond because of their immigration issue. But what I said to these non-citizens on Apple Health are already known to the federal government. So since they're known to the federal government knows their status, we need to ask the questions. We need to help them. When you develop that relationship with the client and help them understand, we're only here to help you. We want you to keep the coverage. Those are the conversations that we have to have with our clients.
What other Apple Health changes are coming down the pike starting next year?
Yeah. So starting in January, people that are on the Apple Health expansion. Now, the Apple Health expansion, that's the program when healthcare reform rolled out that states had the option of adding. And we did. And it's been great. It's been wonderful. Thousands of people in King County got Apple Health expansion, 19 to 64. And that is the population of folks that are going to be impacted by the work requirements. Someone has to work 80 hours a month or make at least $580. They can do volunteer work. They can be in school. There's some other exemptions, but those are coming down. There's still a few rules that are out there that haven't been defined yet, but that's happening. And so we're trying to create that awareness at the same time. Start identifying your clients who are in the Apple Health population. Start doing it now. And that's really going to help build those lists. That's going to help as we start moving closer to when they have to meet those work requirements.
Daphne Pai is a Regional Health Services Administrator with Public Health Seattle-King County. Really appreciate it.
You're welcome. Thank you.
And thanks for listening to Seattle Now. If you've got some time today, take a moment to rate and review the show and give us comments on this episode wherever you listen on your podcast app. Today's episode was produced by Anna Marie Yanni and Brooklyn Jamerson Flowers. It was edited by Caroline Chamberlain Gomez. Our production team also includes Vaughn Jones and Andy Hurst. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Paige Browning. I'll talk to you tonight for Evening Headlines.